Okay, so we're all about really solving problems. And so let's talk about what a person needs to do for a comprehensive approach for cPTSD, somatic pain, and their trauma while also using LUMNA.
Yeah, of course. So, really our goal with LUMNA was to provide enough balance in the nervous system to be able to do the more challenging aspects of self-work, like I said. So that can include therapy or self-care, changing diet and lifestyle factors, including sleep. So it's giving the nervous system enough that deep exhale to be able to do that work more effectively. I also said this earlier, it definitely improves treatment response to other traditional and more experimental healing methods for the mind or the nervous system, which includes psychotherapy, all forms of psychotherapy, EMDR, the Safe and Sound Protocol or SSP, ketamine-assisted psychotherapy or other psychedelic-assisted therapies, neurofeedback, mindfulness or meditation practices, breathwork practices, yoga practices, trauma releasing exercises or TRE, somatic experiencing, family constellation therapy, like you name it, whatever is working for a person. Or I've even seen some of these things like EMDR can be re-triggering for people, so they don't tolerate it. And by having Calm and Uplifted on hand during those trigger events, it can allow them to actually successfully complete the process. Same with the Safe and Sound protocol. If somebody's getting really triggered throughout that series, then using Calm and Uplifted as a sort of grounding when somebody's getting triggered can allow them to actually be able to continue and finish the series. And it definitely, we have some colleagues that are using it in neurofeedback to change the brain waves into more theta, which is like a meditative type state, and theta state or alpha state for focus, clarity. So it definitely will help to improve any for most people, any of those other practices that they're doing, even life coaching, things like that. But I always say, I said this earlier too, it's good to have a trusted physician or psychologist or mental health therapist, a coach, a somatic therapist, massage therapist, someone that's trusted on board to assist in this process, so that it really just amplifies the effects. On its own, just using Calm and Uplifted will certainly work. It'll work both acutely and in the long term. But I do think it's best paired with whatever therapy works for a person or set of therapies works for a person. It just augments that and reduces the amount of time that a course of therapy would normally take. And part of that is, again, because of the neuroplastogenic constituents that are upregulating the neuroplasticity and allowing the nervous system to more fluidly change those pathways with those chemical catalysts. And by chemical, I mean natural medicine constituents, not like medications.
So a couple follow-up questions. What does it look like for somebody if they're only using LUMNA and not doing any of those things for the cPTSD, somatic pain, trauma?
Yeah, I kind of said it before, it will still certainly work. It might take a little bit longer to work because really, even with psychedelic therapy, it's really it's a chemical catalyst to be able to more easily implement changes through those chemical messenger molecules. But it will work without the therapeutic aspect. But when you add some sort of therapy, again, that the feelings of safety and the connection with another person mirroring back at you increases that ventral vagal tone even more. And so people will improve more quickly if they're doing other things alongside LUMNA. LUMNA on its own will still work, but it will take longer. The other thing to be aware of is that, again, especially when working with somatic pain, if somebody's using the product and all of a sudden some strange emotion, they're working on an area of pain, and all of a sudden some strange emotion comes up and they feel very overwhelmed by it, it's good to have some sort of support in somebody else. That can be, it doesn't have to be a licensed mental health counselor or a physician. It can be a friend, a parent, a partner, anybody that's a trusted person to kind of help process what's coming up in case something does come up. And that's not to say that will happen for everybody, but if it does, again, better out than in. It's good to talk about it and process whatever subconsciously is now being brought up to the surface. So yeah, it'll work on its own without anything else, but it's definitely gonna work better paired with other therapies.
Yeah. And I think it's just a really good opportunity. I know when I was working with people with anxiety before the LUMNA journey, it's hard on your own, right? That was one of the reasons that we created it. Like, you can rewire your brain if you constantly shift your thoughts, but it is so hard because your thoughts are just constantly going down that pre-programmed pathway. So it's such a good opportunity to do that work while using it, because you can create that change much easier because the product is also supporting you with that. Okay, so I know you listed different things that people can do. But for somebody who might feel overwhelmed with where to start, what do you suggest?
Really good question. There's plenty of online resources to look up, somatic experiencing practitioners or safe and sound protocol practitioners or neurofeedback in my area or EMDR therapists, any of the things I listed, ketamine assisted psychotherapists. I definitely don't recommend people do psychedelic work, including ketamine work, unless they have a guide and somebody to hold space for them for all the reasons I already listed. You want somebody to help hold space and help you process and give outside perspective. So there's tons of online resources. Even just looking if somebody's really starting at square zero and doesn't know where to start, contact your insurance company, see what kind of mental health coverage you have, and then you can even ask an advocate from your insurance company to find different counselors or other therapists that are in network with your insurance, and start there. I have a ton of resources where I live, but that's not going to apply to where everybody else is. So if cost is an issue, start with your insurance company and see what's covered. Something that I think is really important with therapy, and I've experienced this myself. I think I've had like 2 really good therapists in my entire life, and I've had a lot of therapists, and I really have only deeply connected probably with 2. So don't give up if you find somebody and it's not the right fit. Don't force it. There's so many people that are able to help. Just keep going until you find that right fit. And yeah, but if you're really overwhelmed, find out what's covered by your insurance or just do some research. There's also a lot of support groups, both on social media and online on forums for people with cPTSD or somatic pain. Again, a lot of these various modalities have websites with listed providers in your area. And a lot of these things can also be done remotely. So that's kind of a gift from the pandemic, is that I see my therapist only remotely ever since the pandemic. A lot of these things can be done virtually. So especially if somebody's feeling, maybe agoraphobic, they're afraid to leave, they're really, really triggered. Even just using your computer is not quite as good as in person, but it certainly gets the job done. And don't let the perfect be the enemy of the good. Just do what you can. And the resources are out there, and we're always here to support too. You can reach out to us on social media, on our website. You can reach out to me personally on my personal Instagram, and I can help kind of guide that as well. And I also do, as a physician, I do a lot of these therapies myself with patients.
Yeah, I will say a couple of things on that, which is, I think when you're looking for a therapist, one thing that I think is important is to find somebody who's not just repeating the same problem over and over again, because you want to not be talking about the same traumatic event over and over and over again for years, because that's just repaving that same neural pathway. So that's one important thing to look out for. And then I also find with many things, but with things like this in particular, that's so personality dependent, personal referrals are really good, especially
Yes.
somebody who has had a similar situation to you.
Yes.
And I also wanted to note that we will also include a list of some people that you could reach out to, some people that we work with that we know that can help with different aspects of things. There's Dr. G, who we partner with for the work that he does with somatic pain, and some other practitioners and, people that share resources online free too that we'll share with you.
Absolutely.